Hello and welcome to the Growing Healthy Families podcast. I'm your host, Dr. Scott Haggerty. On this show, I interview the world's top health experts so that you can know with certainty what it takes to give your family a life of epic health and wellness.
As parents, we don't want to see our kids struggle. I knew that he had the potential, and I knew that something needed to be done.
It was hard. We would get frustrated. We didn't know how to deal with it. I was more emotional about it.
Sure that, we're here. Amen to that, brother. Amen to that. Moms and dads, in this episode of the Growing Healthy Families podcast, I want you to hold on for a whole lot of value being dropped by our guest, Dr. Matthew Antonucci, the owner of Plasticity Brain Centers. Moms and dads, Dr. Antonucci is one of the world's foremost authorities on traumatic brain injury, and he is a specialist in working with complex neurological conditions. As the owner of Plasticity Brain Centers, he sees some of the most complex cases that anyone sees in the world. He is a lecturer, he is an author, he is heavily involved in review boards and research. His list of publications is nearly endless. He is a graduate of Central Connecticut State University. He got his BS from Excelsior University. He is a graduate of Life University College of Chiropractic, as well as receiving his diplomate in graduate studies with a diplomate in functional neurology with certification in pediatric diagnosis, functional medicine, vestibular disorders, movement disorders, and neuropsychological disorders, as well as having a master's degree in neurology. His accomplishments are second to none in the field of chiropractic neurology as well as anywhere in neurology. Hang on, moms and dads, because he is going to add tremendous value if you have someone that you love that is dealing with some type of a complex neurological condition, or if you're just looking to enhance brain performance, you'll get massive value from this episode. Hang in there. Enjoy. Moms and dads, I am super excited for this episode because that handsome young man sitting there across the screen from is Dr. Matt Antonucci, owner of Plasticity Brain Centers. Dr. Matt, thank you so much for being with us today.
Oh, thank you for having me. It's an honor and a pleasure. Thank you.
So I'm super excited for this episode because, when we talk about being able to make real changes in people's lives, the work that you're doing at Plasticity Brain Centers is absolutely life-changing for people, isn't it, Dr. Matt?
It really is. I mean, that's one of our things that we strive for. It's one of our principles. It's transformations. You can go and get healthcare and you can get improvements, but we want to see transformations in people that really need them.
Yeah, and that's really what it's all about. And so one of the reasons why we're doing this episode today is because you have really built an amazing reputation for being able to help some of the most complex neurological conditions that exist. But in a very unique and a very special way that I think that as the moms and dads learn about the work that you're doing, I think that it will create a lot of hope, a lot of inspiration, and hopefully give a lot of people access to the kind of care that you can provide. So Dr. Matt, I would love for us to be able to kind of dig into your background a little bit because you have a very interesting backstory. And so when you started out on your path to healthcare, you didn't come in the traditional route. You did not necessarily set out your career to become a chiropractor. What was your backstory? How did you end up in this road?
Well, my backstory was it's very, very interesting, very diverse. I owned a couple of businesses before I even decided that I was going to get into any type of healthcare. But ever since I was a little kid, my mom always told me that I probably would. She said that I had the magic school bus journey through the human body book, and she would read it to me over and over and over again. She said I couldn't get enough of it. So when I decided that I wanted to be an entrepreneur, she was kind of like, really? She's like, I thought you were going to want to be a doctor. So I kind of had a little detour until I found a chiropractor. And this chiropractor, Dr. Church up in Connecticut, we met him at a health screening. And my girlfriend at the time, actually, she was having some pretty bad back pain. And he said that, come into the office, let me check you out. Well, and then we had to do x-rays. We ended up finding out that she had a fracture of her low back. And that's where she was getting all of her chronic low back pain from. And he was like, well, how about I check you out since you're here too? And my story was, no, I wrestle, I ski, I play baseball. I do all of these things. I'm really healthy. I don't need any treatment. So he's like, well, chiropractic care is not always just about fixing something that's wrong. It's about living to your optimal potential. So what does it hurt for me to check you out? And not knowing that headaches weren't normal, allergies aren't normal. Those are all the things that I had. And I just, oh, well, everybody gets them. So I'm just a healthy person, just like everybody else. So I make a long story a little bit shorter. I ended up getting under chiropractic care. My headaches went away. My allergies went away. I felt great. I was doing better at my sports and my athletics. So it kind of piqued my interest. And I was like, wow, this guy, he's helping people. Everybody walks into his office smiling and they leave with a bigger smile. He's really giving real health care, not just treating symptoms. And I was like, this is really interesting. And then, of course, the entrepreneurial side of things is like, well, what is it like to run a business like this? And he says his employees love him. He loves coming to work every day. So it really kind of made me say, maybe this is something that was meant for me. I mean, I volunteered to hospitals and all these kind of things. So I was interested in that. And he ended up taking me down to Life University in Atlanta, and he said, let's just do a guys weekend. I'll show you the chiropractic school, and if you like it, you can apply. So I did. I applied. I got accepted, and the kind of story then took an interesting twist from there. I went to chiropractic school and started studying to be in the healthcare profession. So that was kind of how I got into chiropractic school. But then I think things got a little bit more interesting from there too, if you want to talk about that as well.
I do because, I heard that your path was not straight into chiropractic. I heard there was a little bit of a deviation potentially towards medical school for a little while.
Yeah, I was in chiropractic school, and we were learning all of this, the basic science, and it was like really fascinating. I really dug in hard, and I really became enthralled in the neurophysiology, the biology, the pathology, all of the ologies of the human body. And there just seemed to be some cognitive dissonance. It's like we learned about all the intricacies of the body, and then we would go to our chiropractic classes, the technique classes, and he said, it's all about just taking pressure off of nerves. We just need to make the nervous system flow better, and your patient will just get healthy again. And to me, it just didn't make sense. I thought there had to be more to it. And on my website, there's a story about my grandfather, and I think he talked about it a little earlier, about how, when I was a little kid, they didn't have any money and didn't have a lot of toys, and he would just hand me common household tools to play with. So I'm sitting there trying to hammer a screw into a 2x4, and it just wasn't working. So it was almost like that kind of clicked in my mind, and I said, how can we fix every person, get every person to have optimal health, only looking at giving an adjustment? There had to be more than that, and that's just what we weren't learning. So I really wanted to truly, from my core, help people, and I felt like I needed more tools, and I felt like I needed medical school for that. And interestingly enough, I met a couple people along the way that really convinced me otherwise.
Well, and I'd love for you to go and dig into that, because your story took a pretty cool turn from that point on. So who are the people that poured into you and helped you to redirect your path back towards chiropractic care?
Well, at Life University, we had what was called the Neurology Club, and I had a friend who was going to it, and he says, you know what, I think you should check this out. It's pretty interesting. It's really heady stuff. It's like almost like you've got to study for Neurology Club and study for school. I was like, well, that sounds like a lot of fun, being sarcastic. But I ended up going to it, and I was like, whoa, this is pretty interesting. And it just happened to be, I went to Neurology Club on a Tuesday evening, and that weekend, there was a neurology seminar hosted by the Carrick Institute where Dr. Klotzik was teaching, who is one of the most tenured faculty at the Carrick Institute, and he was teaching the neurology of the chiropractic adjustment. So I happened to beg my mom for some money to pay for the class, and she paid for it and told me I needed to pay her back, and because she thought I was crazy for taking more classes on top of my classes. But I went to that class, and basically what Dr. Klotzik was able to do for me was not just tell me adjust everybody and they'll get better, but basically tell me how a chiropractic adjustment can actually change the way the central nervous system, the peripheral nerves, the spinal cord, and the brain actually functions at its core. And which what ended up happening was that point when I was on that teeter-totter, whether I wanted to go towards medicine or stay in chiropractic, all I needed was something that says there's more than just cracking backs to chiropractic, and I was in it. So I just kind of dove in head first, and throughout the process of taking courses with Dr. Klotzik and then eventually meeting Dr. Carrick, who is the founder of the Carrick Institute. He's the father of chiropractic neurology or functional neurology. And just listening to him speak, it really changed my outlook on what it means to be a chiropractor. And that's really what solidified my instinct that chiropractic was right for me.
That's a great story. And you know, it's funny because I've in a different way, I remember hearing Dr. Carrick and having everything that I thought about healthcare and about the brain and about chiropractic completely flipped on its head in about 10 minutes of him talking and about 1 minute of it, which I understood.
Yeah,
right?
Exactly.
But I realized in listening to what he said that everything that I wanted to know about the human brain and the human body, that it was out there and that he had created ways to understand it to be able to help mankind at a much higher level.
Yeah, absolutely. And one of the things that he told me, because I had a conversation about where I was in my life, you know, that on that teeter-totter, and he basically just told me I had a perspective that wasn't beneficial to me. He said he was saying that I needed to choose, or I was thinking that I needed to choose between chiropractic and medicine. And basically he basically told me, he's like, you're just deciding what tool you want to use. You shouldn't necessarily base your whole life on what tool you want to use, because there's a whole toolbox of things out there, and there's no limit to what you can learn. So right at that point in time, I changed what my definition was of chiropractic. And like I said before, in my mind, just like the rest of the public, chiropractic care is what? I don't even need to finish the sentence, but I can. It's going to somebody and having them cracking your neck and back. Mm-hmm. Well, that's one thing that a chiropractor can do out of the millions of things that they actually can do. Mm-hmm. So, you know, the chiropractic adjustment is just a tool. And what Dr. Carrick was able to expose to me is all of the other tools that I have at my disposal, just like my grandfather did when he said, here's a screwdriver, you know, try using this. This will work a little bit better for you.
So true. So true. And I think that's a great statement, that the tool shed is so much bigger. I think and I remember sitting in school too and feeling the same way, that, you know, the toolbox didn't feel as big as when I heard Dr. Carrick and when I met you, as the same time as I actually learned about Dr. Carrick's work. Remember realizing that the world felt so much bigger, and what we could do, we could change the brain and the way the nervous system worked by adjustments and the things that you can really do that were not taught necessarily in school.
Yeah, and by him saying that, it kind of just dawned a certain responsibility on me as well too. It's like, you know, I've got 5 kids. I can give them access to my tool room at my house. That won't be very pretty because they don't know how to use half the tools that are in there. And they may get hurt, or they may hurt somebody else. So when you have exposure to all those tools, you have, it's like Superman, right? Great power comes great responsibility. Mm-hmm. So learning how to use all these different tools. And when we talk about tools, I mean, some people might think of mechanical instruments, but a tool could be physical therapy. A tool can be occupational therapy. A tool can be cognitive rehab, or lasers, or hyperbaric, or supplements. Mm-hmm. These are all tools that can help change somebody's health state. And if you have the knowledge to support the use of it, if you understand to the core of what that thing is doing to that individual who's asking for your help, I mean, realistically, you're limited by how much you can learn. And I loved that expansiveness, that ability to say, okay, well, I want to help this person sitting in front of me, and in order to do this, I have to go out and learn this. And I think that's what people want. That's what people want from the doctors these days. I mean, that the information is out there. I mean, let's face it, a lot of patients can get smarter than doctors going on Google. So, you know, realistically, patients demand that their doctor be smarter than Google. And in order to do that, you have to have education.
So true. So true. And, you know, since you did go down the road and talk about the education, so you graduated from chiropractic school,
yep,
right? To become a functional neurologist, it doesn't on there.
Yeah, absolutely. And there's a little bit of controversy because since you brought it up, a functional neurologist actually, a functional neurologist is a certain thing that really doesn't exist. Me personally, I'm a chiropractic neurologist, and I have a fellowship in functional neurology. So what I ended up doing is after chiropractic school, I sought to be a chiropractic neurologist and study functional neurology. It may seem semantical, but it is what it is. It's a chiropractic neurologist is recognized in I think 48 out of the 50 United States right now, some other foreign countries as well too, whereas a functional neurologist isn't really technically recognized anywhere.
Mm-hmm.
So to be a chiropractic neurologist, it's just like in medicine. You can go to medical school, you get your MD, you do your residency. After your residency, you can become a general practitioner, family practice. You can go on and do additional residency in general surgery. You can do additional residency in cosmetic surgery or orthopedic surgery. And all along the way, you've got to pass board examinations, but it's a further education. So the education that you have to continue to seek to become a chiropractic neurologist is 300 classroom hours, which typically takes somebody about 2 years, the way that these courses are offered. And there's a whole bunch of hands-on activities that you have to master in order to sit for and pass the board examination. And after you pass that board examination, you can actually be called a chiropractic neurologist.
So the process of becoming a chiropractic neurologist is very involved. And I've actually gone through a pretty large portion of the process myself. It's amazing the kind of things that you learn in the tool shed that you build as you go through that process. When you get out there and start applying the things that you've learned, you can really make some massive changes. And so, you've been out in practice now for a number of years, and you have a laundry list of large accomplishments. Reflecting back on some of the things you've accomplished, what would be one of the more significant accomplishments, whether it's a patient accomplishment or something that you've accomplished in your career that really impacted you?
That changes every time I'm asked it. And right now, because I'm evolving as well. And my original inspiration or my goal or what I held myself to is to help as many people in need as I possibly could. At first, that started one patient at a time. Then, of course, I was able to have the great fortune of finding some people that had the same thoughts and visions as I did that wanted to work together with me and began assembling some chiropractic assistants and some help, but it was still a one-man show. So I think at this point in time, I feel that the greatest accomplishment that I have is my team. I feel like I've been able to pass it forward. Dr. Carrick and Dr. Klotzik, who were my mentors and still are, were able to bestow a certain knowledge and a skill set on me. And right now I have a whole team of doctors at Plasticity Brain Centers that I've been working with for, one of them up to 9 years already, working with them for almost a decade and been sharing what I know with him. And what I'm finding is that we went from helping one person at a time to 5 people at a time to 10 people at a time. And we're just helping more and more people. And currently where we're at is we're trying to figure out how to make it so that we can help hundreds and thousands and potentially tens of thousands of people at the same time. So right now, I feel like my proudest accomplishment is how great my team is.
That's a great thing because it's, especially as a practitioner and a mentor like you've become, the legacy you leave is going to be the people that you've trained to carry on the work. And so I think
Absolutely.
That's a good accomplishment. That's fantastic.
Yeah, thank you.
Oh, absolutely. I very much resonate with what you said there. And you did talk obviously about your actual practice, Plasticity Brain Centers. And I love, because the name is such a well-encompassing name, a lot of people are not familiar with the term of brain plasticity.
Right.
So for the folks that are watching that aren't familiar with brain plasticity is, can you talk about what that is as a concept and how you can actually apply that in clinical practice?
For sure. When I try to understand something, I always try to get to the root of what it is. So the word plasticity comes from the Greek word plastos, meaning moldable. So when you talk about brain plasticity, it's about brain moldability. And what we actually call this is not just plasticity or neuroplasticity. What we actually practice is either activity or event-related neuroplasticity, which means that something happens in the environment that changes or molds or shapes the way your brain is. And the most common example of brain plasticity happened a long time ago, and a lot of people know about this, about Pavlov and the bell and the dogs that salivate and things like that. So Dr. Pavlov was able to train his dogs that whenever he rings a bell, that they start to salivate by presenting them a sensory stimulus or food at the same time as the bell. So basically what ends up happening is there's a Canadian psychologist called Donald Hebb who said when two neurons fire together, they then wire together, not physically like a wire, but they become connected in time and space, and they become efficient together. So brain plasticity is essentially a synonym for learning. You know, people can learn math, people can learn languages, but people can also learn to walk. People can learn to breathe differently. People can learn to move their eyes differently, their body differently. People can learn to process sensory stimulus differently. And if that's kind of hard to fathom, think about somebody that came back from war. Every time they hear a door slam, they think they were trained that that's a gunshot and they have PTSD, right? So our brain is so moldable. The whole point of our brain is to be moldable. It's to be able to adapt to our environment so that we can most effectively use our environment for our survival. So brain plasticity could be negative or positive. Negative meaning like PTSD, depression, anxiety, things that affect us and really deter us from being the best human being that we can be. Or neuroplasticity could be better, meaning that we can walk better, talk better, think better, hear better, see better, react better. Those are different types of brain or neuroplasticity that keeps us surviving and makes us more efficient at our jobs, at being parents, at being children, at being somebody that exists on this planet.
I think that is such a great explanation. And I love the fact that you brought that into quality of life, not just the problem, because it's so much about how we experience life is completely about the way the nervous system is able to live in the environment and perceive the environment and then be able to outwardly express it. And I think that's tremendous. You know, I want to bring it back into something that's very tangible that a lot of folks may have experience with. So you've become one of the world's leading experts in brain injuries. And you get results that are uncommon, helping some of the most difficult cases in the world to be able to have amazing recoveries from traumatic brain injuries. Could you perhaps explain how a person with a traumatic brain injury's brain has been affected, and then how you use neuroplasticity, brain plasticity to help them have a better quality of life?
I can try. We don't understand it so well at this point in time. Just like a lot of medications, their mechanisms of actions aren't understood. We know they work, but we don't exactly know how they work. We know pretty well how we're doing works, and especially when it comes to brain injuries, you've got the whole spectrum of brain injury, from a mild concussion all the way on one side to a really severe brain injury on the opposite side of there. But all of them have a common mechanism, just a little different. So all the way in the mild form of concussion, this is the type of concussion where you hit your head and you maybe see stars or hear a bell, or these sort of euphemisms of having a concussion. What happens in that situation is your brain gets shaken up. You have some injury that occurs on a cellular level. Neurons release chemicals that make the nerves really excited. So basically your brain starts to get overexcited. That's why you see stars, or you hear ringing, or you taste metal in your mouth. You might be a little disoriented, and then all of a sudden you bounce back, because there's special chemicals in our brain that say when the brain gets too excited, let's slow it down. Now, when we keep moving up that spectrum, the larger the injury is, the more of the excitement that happens, the more chemical, the sleep chemical, I'll call it makes your neurons go to sleep, more sleep chemical, it's called GABA, is released, and that shuts off those neurons so that they can start to heal. Now, that might be not necessarily loss of consciousness, but that might be that dazed sort of, I don't feel like myself anymore. and you continue going on with the game and you just don't remember very clearly what happened in there. That was a situation where those chemicals were released. But what was evidence or research has showed is sometimes when those neurons go to sleep, they don't necessarily wake up right away. It's not necessarily that they're dead, they're just hibernating. But let's face it, we're human beings. We need to do things. We need to play our sports. We need to go to our jobs. We need to walk, talk, move. What ends up happening is that while those neurons are sleeping, think of like an assembly line at a factory, the other neurons have to make up for the work, and plasticity occurs there. Those neurons get more efficient at doing a job they weren't originally supposed to do. So your brain rewires to compensate for that small or minor concussion that you had. And that happens all the way up the spectrum until you get to more of a moderate TBI, where you actually have bruising or bleeding, significant losses of consciousness, which as we start moving into that category, you get more of a stroke sort of phenomenon where there's actual anatomical damage that you can see on MRI, on CT scan, on PET scans, where we can say that part of the brain is injured. In that case, we have a certain part of the injury that is called the core of the injury. Those neurons die and we don't think they ever come back to life. We have the area around it called a penumbra, which is an area that's asleep, that's not easily woken up, where rehab has to happen in order for that to happen. And then you have the area that's kind of compensated around it. So when we start looking at things from a rehabilitative perspective, the first thing is to ascertain if the neurons are dormant, if they're awake, if they're not just functioning well, if there's compensations, if there's decompensations, if there's actual physical damage, and then we have to reassess what our plan is based upon that individual. So that comes down to our motto is that we don't treat brain injuries. We treat people that have brain injuries, because every single one is completely different. Every single case is a unique case, and every single case needs to be assessed and treated as their uniqueness.
I think that's a great summary for that, because it's so true, because no person will experience a brain injury or any kind of a neurological condition the same way, will they?
No, I've got two sets of identical twins that have the same exact genes as each other. Mm-hmm. They, God forbid, could have a concussion the same exact time, and they may most likely have completely different symptoms, even if they were in the same exact instance. Let's just say it was their golf cart crashed or something like that. God forbid, they could have a concussion, same genes, same everything. They could have different symptoms. So you can't necessarily treat the concussion. You've got to treat the individual.
So true. So true. So Dr. Matt, in your clinic, you see a wide range of different types of neurological conditions coming in. Would you mind telling the viewers about some of the more common conditions that you work with in your practice and how you work with those?
Yeah, I can try to do that. One of the things that's really tough is that realistically, anybody that has a brain that wants to have it function better, we can help them. So typically people come into us two different ways. Number one, either that they had something happen or they've had a condition for a period of time and they're just fed up with it and they want to get better quick. The second is if they've been working with a practitioner for a while, they've seen some great progress, but either they came to a little bit of a plateau or they're just ready to kind of jump over the next hurdle. Those are really the two types of patients that come in to us and see us. And the reason why I haven't said any type of really diagnosis yet, because it's pretty expansive. We treat everything from ADHD, autism, balance disorders, concussion, dyslexia, cerebral palsy, Parkinson's, Alzheimer's, dementia, ataxia, movement disorders, tremor. The list goes on and on and on. And that's because of our core philosophy is treat the person, not the problem. So people just come to us, even sometimes without any diagnosed conditions. Like we've had Olympic athletes that have come to us that have been competing in the Olympics, and they needed to shave 1/10 of a second off their reaction time, because in swimming, 1/10 of a second is the difference between a no medal and a gold medal. Mm-hmm. So we've had people that say, listen, my neurological hurdle right now is my reaction time. I've trained my physical performance. I'm as fast as I can possibly be from a physical perspective. The only place where there's a little bit of room where I can shave off is how fast I get off that block. So everybody that comes to us has some sort of a desire or a challenge. The challenge might be moving your arm or leg or balance or sensory processing, or it could be something where you're just such a fine-tuned individual, whether you're a CEO, executive, or an athlete, that you just need to be one step better than when you're currently at. So once again, treating the person, not necessarily the problem.
I think that's awesome that you say that, because when you look at the brain's performance, right? So it's so awesome that you can address it from so many different ways based upon what the person needs, right? Because I mean, whether it's performance in business or performance in sport, whether it's you're having a real neurological challenge like, CP or, autism, it's about helping to improve the quality of life for that individual. And I think that's so cool that you make it person-based, individualized, that person's care and what their ultimate goals are.
Right. And the common denominator is actually pretty simple. It's how efficiently and accurately you're getting information in from the world, and how efficiently and accurately you are getting information out to the world. That's the commonality between every type of neurological condition. Either information's not getting in properly, it's not getting processed properly, or it's not getting out properly. So it really makes things not necessarily simple, but it makes things easy, because it's still very complex, but it makes it somewhat easy to help individuals from all different backgrounds. Whether it's memory, which is, once again, processing, or somebody, for example, that may have cerebral palsy and not be able to move or communicate, but they can get information in really well.
Yeah, that's great that you said that. You touched on something, and I want to just kind of illuminate the difference here for a second. You talked about, you get people who oftentimes come from different perspectives. Maybe they've gone to like a medical neurologist or been in some other modality, and they've reached a plateau. So for those who are not familiar with the difference between a chiropractic neurologist and a medical neurologist, would you be able to highlight some of the differences?
Yeah, there's one really core difference. A medical neurologist has the ability to write prescription or legend drugs, so they can give you a pill for something, where a chiropractic neurologist, in most places, most states, there are a couple exceptions, I think in New Mexico and a couple other different areas where most chiropractic neurologists cannot write a prescription for a drug. So it comes down to the tools. Most medical neurologists are not trained in vestibular rehabilitation or vision therapy or chiropractic manipulations or things that most chiropractors are trained in. But in the same sense, most chiropractic neurologists are not trained in prescribing medication. So they're both individuals, neurologists, meaning they study the nervous system, that have different tools. So and those tools are for different reasons. If you are in the process of having a stroke where your face is starting to droop and you're slurring and you're getting dizzy, by all means, do not call me. I am not trained to deal with somebody who's having an acute stroke. But a medical neurologist is absolutely trained to deal with an acute stroke. But my buddies who are our medical neurologists, they'll tell you, we didn't really do a whole lot in rehabbing strokes. We can handle an acute stroke, but we're not really so familiar on the process. So they typically refer to physical therapists for that, or vision therapists. But I think there's one more differentiation that we have to make between chiropractic neurologists and medical neurologists, and then chiropractic neurologists and other type of therapists. And I think it also is the same differentiation. It's the type of tools that they're trained to use. You could think of a chiropractic neurologist as almost like a Swiss Army knife. They're very versatile. They know a lot of different things, and it's how they combine them. So I've got an animated video that's online that really, it was just like the way it just came to me. It just seemed really silly, but I'll say let's roll with it. But it actually works really well. It's this metaphor that fixing a brain is very much like baking a cake. It has to do with the ingredients, the amounts, and the timing in which you combine them. And that's brain rehabilitation itself. The ingredients would be the type of therapies you do. The amount is how much of that therapy you do. And the timing is, do you put them all in together? Do you do them separately? Realistically, there's a recipe for brain rehab. And chiropractors I would beg to say, are obsessed with how meticulous those sensory stimulus are delivered, because we believe that the brain processes the environment so precisely that in order to make precise changes, you have to deliver precise interventions. So a chiropractic neurologist may, in one session, do a chiropractic adjustment, may do vision therapy, may do vestibular rehab, may do hyperbaric oxygen therapy, may do nerve stimulation, may do physical therapy, may do gait therapy. It's limitless what a chiropractic neurologist can do as long as they're staying within inside of their state-defined scope of practice.
That's excellent. And I think that the distinction, I think, is super important there because, obviously I've seen a lot of the work that chiropractic neurologists have done with their patients, and the fundamental changes in quality of life that their patients experience, I think is really amazing. And one of the places where I've really witnessed a lot of amazing changes from chiropractic neurologists is in the work with people that have different types of neurodegenerative conditions.
Yeah.
And I would love, because, part of my motivation for this is we have a number of people that I know personally that I care for that have moms and dads that are going through the process of cognitive decline due to dementia.
Yeah.
And, it's obviously something that can really affect the family. And obviously the person is in a place where quality of life is going down.
Yep.
So I would love for you to be able to go and spend a few minutes talking about your work with neurodegenerative disorders in terms of quality of life improvements for these folks.
Absolutely. And the way you just ended that question was perfect for me, because realistically, when it comes to neurodegenerative conditions, that's what we're doing, is just enhancing or improving quality of life, because there's not enough known about degenerative conditions to figure out whether it was chicken or the egg, right? So is a neurodegenerative condition primarily a brain dysfunction that just manifests as a large compensation later in life? And we often use an analogy for this where it's like, launching a rocket into space. If it just goes off 1 degree, it's not so far off until it's 100,000 miles away. So you might have had an incident like a car wreck when you were 16 years old that apparently had no effect on your life, but being 65 now, that may have been what kind of knocked you off course. So that's one philosophy. Another philosophy of these degenerative conditions is there's a genetic component. So you're encoded to, for lack of a better word, self-destruct at a certain age, which I don't think that's 100% accurate, because I think that there's things you can do in your environment to change that. And then there is more of like that, what's called epigenetic approach, which means that everything in your environment dictates how well your body functions. A lot of people are thinking certain types of neurodegenerative conditions originate in the gut based upon the food that you eat, the quantity of food that you eat, the quality of food that you eat, but also the inflammation that can happen as a consequence to having things like leaky gut. So when you have all of these different philosophies that are all seemingly quite different, I think the conclusion you can come to is we really don't know what's causing the neurodegenerative condition. So we are not necessarily fixing the cause of the degenerative condition. What we're really addressing is the quality of life, and what we've observed is the slope of degeneration. So some of our patients with Parkinson's disease, when they come in for our program, they are at a certain place. They actually make a huge improvement and maintain that improvement for a long period of time with very little degeneration. Some of them make a big improvement and just degenerate a little bit slower. Some of them make a big improvement and they degenerate at the same speed. Some of them just degenerate slower with no big improvement. So it's different for every single patient. But one of the things that happens across the board is through retrospective analysis or looking back on our patients, nearly 100% of our patients that have a degenerative condition say that my time with you, meaning me and my team, was worth it, and I saw a significant change in my quality of life.
And that is huge.
Yeah.
Because if you can put quality into those latter stages when people are in these neurodegenerative states, quality is the only thing that really matters.
Yeah. Did you know that they did a study that most older people, and when we say older, they assessed people from ages 55 and over. Some of you might think that's not very old. I don't think it's very old. But they assessed people from 55 and over, and they asked them, what is your biggest fear in life? And they gave them a checkbox, and they gave them a list. They said, is it running out of money? And that wasn't it. Is it dying? That wasn't it. Is it, they asked all these questions. The number one fear of individuals over the age of 55 is actually falling and having a poor quality of life. So it's not, when you get over that age of 55, it's not quantity, it's quality. So most people over the age of 55, and now I even talk to my parents, my mom's like, I don't really care if I live any longer. I just want to live better quality. It's not about the number of years, it's the quality of the years that I have left. So I think that resonates with what you just said. The quality changes is really what people are striving for.
So incredibly true. So incredibly true. And, you know, I'm sure if people are listening to this, they're probably wondering, like, how does this process work? How do you get down to understanding what's happening inside of a person's brain? How do you evaluate them? How do you examine them? So would you mind spending a few minutes talking about if a patient comes in, and let's say, for example, it's a patient who has Alzheimer's.
Yep.
What would the process of evaluation look like so that you could be able to come up with an appropriate care plan for that individual?
That's a great question. It's a question that we get asked all the time. And because we get asked it so many times, we have a really good answer that we just repeat over and over again. The process is the same for everybody because we don't treat Alzheimer's, we treat people with Alzheimer's. So we have a process that we've implemented after my decade of doing this, and then following Dr. Carrick around for a while, and Dr. Klotzik around, and some of my other mentors. So we've been able to assemble a process that's self-contained, meaning that you come to us, we have everything here that we need to assess your function, regardless of what your condition is. And all the testing that we do here internally at our center provides us with the data that we need to craft a custom program for you. And what that looks like, and we try to do everything on everybody, but we understand that not everybody could do everything. So we try to capture this data on everybody, because even someone that we couldn't capture data on, let's just say if somebody was in a wheelchair or they couldn't do a balance test, we just try to do it, and we say that we couldn't do it because being able to do that test at a later point in time is an accomplishment if you couldn't do it to begin with. So one of the nice things about working in the model that we work in, we just do everything as far as assessments to everybody, collecting as much data as possible. I often tell my patients that I'm like a brain detective. I need as many clues as I can possibly get to be confident in what I'm going to do for them. So we look at both like blood pressure, heart rate, which is called autonomic testing. We do cognitive evaluation, where we have some sophisticated computer technology where people have to answer questions, and we get their ability to look at working memory, spatial planning, executive function, things like that. We do reaction time, hand-eye coordination, eye movement, eye tracking, vestibular testing. It's 3 hours of testing that everybody does on their initial visit that really allows us to have all the data, and that includes a very, very comprehensive evaluation. So comprehensive that I hear it all the time that people say, I've never had this comprehensive of an examination by a healthcare provider in my life. So realistically, it's looking at all the minutia, making sure every I is dotted, every T is crossed, every box is checked, to figure out what type of information we can gather from an individual to create the best plan moving forward. And then we do that multiple times to assess our progress.
And that is really the most critical thing that you can say, is that you're gathering this information. I love when you said brain detective.
Yeah.
Because, the brain is the most complex structure, period, in the human body.
Yeah.
And you have to play Sherlock Holmes to be able to come up with an appropriate care plan for that individual. So I love the fact that you talked about that, because it's so incredibly true.
Yeah, we call it CSI and not crime scene investigation. We say cerebral systems investigation. So it's like our corny joke, right?
It totally sounds like a T-shirt, though.
yeah, exactly. Good idea.
I know, right? So then, obviously you go to exhaustive lengths to gather information. You put that into a care plan. And I know that in your care plans, they're really broad and diverse. Like you talked about, having a massive tool shed. Mm-hmm. And I know that you use a lot of different types of forms of rehabilitative treatments for your patients. Mm-hmm. And so I'd like if you could spend a minute talking about what some of those things are, and also if you could spend a minute too, because you have a very unique piece of equipment in your office by having smart therapy.
Yep.
So
Absolutely.
some people videos and things like that of smart therapy, but probably don't know much about it. So would you be able to talk about smart therapy and some of the other things that you utilize to try and help with neuro rehab?
Yeah, absolutely. So the types of I guess treatments that we do can be categorized into two different major categories: passive therapies and active therapies. Just like the brain, passive therapies are sensory based modalities. So that passive means that something's happening to you and it's going into your body, and active means that you're doing it. So sensory versus motor. Those are the two major types of categories of therapies that we do. In the active types of categories, we can do vision therapy, vestibular therapy. We can do gait therapies, things where you're moving and interacting with things. From the passive side of things, these are sensory-based modalities, which might be electric stimulation, and sometimes not even sensory. We do laser therapy, like I think you do as well too, where that is something where somebody just sits there and it happens to them. And then the SMART therapy, which stands for single and multiple axial rotational therapy, mouthful. But basically what this is that you get placed into a device that we call our MARC. We love acronyms, a multiple axis rotational chair. And then what that allows us to do is that allows us to take a whole human being and move them in space. So a single axis rotation might look like this, right? You're just moving in one axis. This turning is called yaw. We can move somebody like this, their whole body like this, which is called pitch. And then there's a third axis, which our device is the only device in the world that's been manufactured that does all three of them. The other axis is this, which is called roll. So what this allows us to do, because some people are saying, well, what does that have anything to do with anything? I mean, I can turn it a desk chair. Well, what it allows you to do is have complete control over somebody's body, doing a passive movement therapy, so we can do it repetitively, accurately, at the same parameters, in the same direction, same vectors of movement. So I guess now the bigger question is, well, what does that type of movement do for your brain? We have organs, not organs like livers and kidneys, but they call them organs. They're structures that are inside our inner ears that detect movement in space. And those structures in the middle ear detect gravity, up and down, translation like stop and go traffic in your car, side to side movement as if you're stepping side to side, and then they do rotational or what's called rotational or axial types of movement, which is rotation, which is in yaw, pitch, and roll. So there's 6 different things that movement of somebody's body can stimulate in the inner ear, which helps them do a whole bunch of things. That inner ear is called the vestibular system, and there's massive amounts of research that shows that the vestibular system is essentially the foundation of everything that we do. It helps us know where we are in space. It contributes to thinking. It contributes to movement. It contributes to how we perceive the world, sensory information. So if we can enhance the vestibular function, that means we can enhance your ability to know where you are in space and interact with space a bit better.
That's such a great thing. And interestingly enough, I just posted onto Facebook today a research article that was done by Dr. Sam Wang out of Princeton about developmental diaschesis.
Yeah.
And for the moms and dads who have read this or who have a child with autism, so very interesting stat that I pulled from that. He said that interference to the development of the part of the brain, this cerebellum, so correlates higher to the development of autism than smoking does to the development of lung cancer statistically.
Wow, I didn't read that one. That's pretty cool. I know the author, but I haven't seen that paper. I'm going to have to check it out.
Yeah, I just posted that particular snippet today. And so when you talk about the influence of rehabilitating the cerebellum and the vestibular system, the amount of things that you can help by changing that are just absolutely massive. So I'm so glad you spent time talking about that, because when you talk about the context of how the brain is going to heal, how the brain is going to improve its function, having a context like that, I think, is huge.
Yeah, absolutely. And that cerebellum is so important for everything that we do. It's called a neural integrator, which means it takes information going in and modifies how it goes out. So it does that for your inner ears. It does it for your arms and your legs and your mouth and your tongue. So basically, I always tell everybody that your cerebellum is like the conductor of an orchestra, really not playing any instruments, but take him away and that the core of the symphony goes gone. It's gone. So the cerebellum is really important, and the way that the cerebellum can be influenced in individuals who have learning or developmental disorders is by doing things that evoke cerebellar activity, such as vestibular movement, such as hand and arm and leg movement, cross crawl movements, all of these different things, primitive reflex retraining, eye movements, all of those things that are actually very similar to every other neurological conditions can really benefit somebody that has one of those types of developmental challenges.
Yeah, that's excellent. And, that's obviously something that I'm super passionate about here, because that's the core of what we do. And I think that, in kids who are being diagnosed at just such epidemic levels, having an understanding of that, how important that type of retraining is huge. So I'm glad that you spent some time speaking about that. Absolutely.
My pleasure.
So, Dr. Matt, obviously at this point in time, a lot of people probably are interested in learning more. So I would love if you could spend a moment talking about if someone were looking to learn more about, coming to Plasticity Brain Centers, how would they be able to work with you directly, or if they're not in your area, in your geographical area, could they work with you, or how would they be able to go and get the help that you deliver?
Absolutely. So I guess with this kind of multifaceted question, so there are a lot of people that know the information that I know. These individuals have taken courses with the Carrick Institutes for graduate studies, which Dr. Carrick founded, and I've been on faculty there for just about 8 years now. So I've created a couple programs. So there's doctors throughout the world. I think there's something like 2,000 or 3,000 chiropractic neurologists in the United States, and 1,000 or so abroad. So there are definitely people that know the information that I know. I know that the Carrick Institute has trained over 18,000 doctors. Just 3,000 or so are certified because the certification process is rigorous. But as far as things at Plasticity Brain Centers, we have one facility right now in Orlando, Florida. Maybe more in the future, don't know, but like I said, my goal is to help as many people as humanly possible. In order to do that, we need to get closer to people. We have people that are traveling from the Middle East, from Europe, from Africa, from Asia, from Australia, from all over the world to get treatment here, and it's not exactly the easiest thing to do. So, and it's not the easiest thing to provide follow-up care either. So one of our core philosophies here at Plasticity is collaboration. We love to work with individuals' healthcare team. We want to create an all-star team with you as being the center of the team, you being the leader, telling us what you want to get accomplished. If you want to be faster or stronger or feel better, it's our job as your team to support you in order to make that happen. So what we try to do is we try to have our program here, which right now is a 5-day program, where we figure out what's going on with somebody, play CSI, get all the clues, the data, create a plan, make sure that plan is effectively working, train the person on how to do it, and then hand them off to their either current healthcare provider or match them up with somebody close to them that can help work with us collaboratively to continue the plan moving forward. And it's been so super effective now. And what it actually led to was us creating something that we call the Plasticity Neuro Network. The Plasticity Neuro Network is something that we created, and all it is it's nothing where there's money exchanged. It's all it is. It's a group of like-minded individuals, like-minded and like philosophy, meaning that, hey, I'll send you a patient if I can't get them better. You send me a patient if you need me to help you, and let's just work for the good of our patients in order to get them as well as possible. And we wouldn't be able to function without our neuro network doctors. So we have about 200 doctors in our network throughout the world that we typically send patients back to them for follow-up care. And they typically send patients to us when they just get a little stumped. But the nice thing about those neuro network providers is they're also thought leaders in their community. So they're getting referrals from other doctors to them. So realistically, what we've done, just as the name suggests, we created a neurological network of doctors that allows people to have the confidence that there's always an option. It's never a dead end. There's always somebody else that we can pull in and we can collaborate with in order to do that. And inside of our network, we've got chiropractors, chiropractic neurologists, medical doctors, physiatrists. We have physical therapists, occupational therapists, psychologists, psychiatrists, a bunch of different individuals. So we can always call on the right people that we need to in our side of our network.
And it is so refreshing to hear that that type of a collaboration exists. And that's one of the reasons why I'm glad that you brought up your neuro network, because when I saw that, it really said to me that the altruism with which you work is about what is best for the patient, helping them, creating resources. And, it really stands to as a testament to what you're doing in your clinic and trying to help to go and change the lives for the better of so many of the patients that you work with.
Well, that's why we're here. And that's my whole entire team. That's why they've gotten into this type of an occupation. It's not to get rich or to have status. We are here to serve. And if you're not here to serve, then you're not on our team. So all of our team has been screened for that because we all have a common philosophy, and we are here as servants to those who are in a situation that they need help. And we call on our patients when we need help as well too. We have doctors, lawyers, accountants. So it's all about helping one another. It's this camaraderie, it's collaboration. That's what we really thrive on, and that's what really ensures everybody's success, not just in occupation or business, but also in life.
That's awesome. Dr. Matt, I thank you so much for your time. And I know many of the people that have listened or watched today, they probably have their interest quite piqued by all the things you've talked about. So where can our viewers or listeners follow you both online and on social media?
Got a lot of different places. So as far as individuals who are healthcare providers that want to learn more, CarrickInstitute.com is where all the classes that I teach. I exclusively teach for Carrick Institute. You won't find me teaching anywhere else besides the Carrick Institute. So all my schedule is there, unless it's for a state association or something like that. DrAntonucci.com also has a bunch of information on it. Plasticity Brain Centers is the only place that I see patients, and I see it with my team. So we've got a very robust team that I've hand-selected and trained. So there, Twitter, you can follow us at Plasticity DRS, like Plasticity Doctors. Facebook, it's just search for Plasticity Brain Centers Orlando. That's our Facebook. So we've got all sorts of social media. We've got Pinterest, we've got Instagram. We're everywhere because people are demanding that we be everywhere. So I think if you even just Google Plasticity Brain Centers, I think all of the information that you want to find will be there, whether it's a social media account or if it's our website with information and blogs and so on.
Awesome. And in the follow-up notes here to the show, we'll make sure we put all those there. So anybody who is looking for more information about you or about Plasticity Brain Centers, they'll have easy access to get there so they can get the help that they need. Dr. Antonucci, I know your time is very valuable. I very much appreciate you taking the time with us today so that we can teach more people about the amazing resources that are available through chiropractic neurology and through Plasticity Brain Centers.
Absolutely.
Thank you so much. So
my pleasure.
I'm so glad we had the opportunity to do this today. So moms and dads, in watching this today, I know that many of you probably are thinking about someone that you love. I know that many of you probably are thinking about what would it mean for a better quality of life for my son, my daughter, my mom, my dad, me. If this is something that you're sitting there thinking, then make sure that you take action. Because I can tell you firsthand from watching the results that Dr. Antonucci, the folks at Carrick Institute, the results they get are uncommonly good. I've been beyond impressed. It's like watching the Matrix from the outside in, seeing the kind of changes they're able to go and bring for quality of life for people who are really struggling. So I would encourage you to take action, click the links, follow the addresses that he gave you, so that you can get the information, so that you can get the quality of life improvements for yourself or your loved one that you deserve. So moms and dads, make sure that if this is your first time watching the podcast, so that you click subscribe. If this episode was valuable for you, or it would be valuable for somebody that you love, make sure that you like it and that you share it. Because the only way that we can help as many people as possible is by getting this information out to the world. So we need you, because you're a part of this episode, you're part of our mission. So make sure that you pass this on and get this in the hands of the people that need it the most. Dr. Matt, thank you so much again. It was a pleasure.
Pleasure is all mine. Thank you so much for having me, and it's a pleasure to be able to share my passion with your audience.
We thank you so much for all the work that you do. God bless you. And we'll have to have you back on here again another time so we can dig in deeper into the amazing work you're doing at Plasticity Brain Centers.
I'd love to. Let's do it.
All right, excellent. So moms and dads, thank you so much. God bless you all. We'll see you on the next episode of the Growing Healthy Families podcast. God bless you all, and be elite.
Thank you for listening to the Growing Healthy Families podcast, the world's #1 source for health education. Make sure to go to iTunes or wherever you listen to podcasts and give us a review. Make sure to follow us on social media at the links listed in the show notes, and let us know what area of health you are struggling with, so we can get you and your family on the road to epic health.